What's going on, everyone? Welcome to the Sunday edition of the Pandemic Update for Sunday, May 21st, 2023. Hopefully everyone's staying safe, healthy. If you had to take a COVID test, hopefully you've tested negative. Hopefully everyone's having a good weekend so far. And I'll tell you what, for a Sunday, there's quite a few news stories to report on for today. As you know, we get less data on the weekend, but I actually have quite a bit of things to show you today. And first off, starting off like we have been with India, 756 new coronavirus cases and just 8 deaths added in India today. Then we move on to this, and this has to do with the XBB 2.3 variant. WHO designates the XBB 2.3 variant as a variant under monitoring and warns about increasing COVID-19 deaths in Southeast Asia. So this wording where they say variant under monitoring, I don't know if that's going to replace variant of concern. This is the first time I've seen them use that term before, but it's not good to see Southeast Asia deaths rising, and the fact that they still have to monitor a variant closely. You would think it would still categorize this as a pandemic emergency, but as you know, the WHO ended it, as did the CDC as well, and there is definitely a rise in deaths in Southeast Asia. Thailand, we know, has been seeing a increase in deaths. The Philippines has been seeing an increase in cases. So it is something that we are continuing to watch, and I do think this eventually could overtake even the XBB 116 variant, because remember, XBB 2.3 was found to be 50% more transmissible. And look at this, the XBB 2.3 sublineage is already found in 47 countries around the world. Interesting that there's that many countries that are actually sequencing, because I certainly can't find 47 countries worth of sequencing data, although you saw yesterday the sequencing chart that I showed, and I had quite a few up there, but it definitely was not 47. Moving on to our next story. This is one where we're just going to read a headline. Number of UK people with heart rhythm condition rises by 50% in 1 decade. That's relatively concerning. So even if it started happening before the coronavirus, that's something you don't want to see. It just shows an overall need for more attention towards healthcare in this world. We need to, pay more attention, give more care to people who need healthcare. I mean, all these fast food places. Let's just start with that. These fast food places. It is so unhealthy, and yet I see lines, and this has been happening before the pandemic. Just constant lines of people in line for food. It happens here in the United States and happens over in the UK. McDonald's, Wendy's, Burger King. I mean, I get it. We're in a bad pandemic, and I've been saying all along the pandemic's making things worse, but it doesn't help to see all these people that just eat all this unhealthy nonsense. I mean, there's a whole nother side to the health problems in this world on top of coronavirus. And, well, when coronavirus came to town, it just overwhelmed the health system altogether. Take a look at this. We reported on this before. I believe there's an update to it. Recall to contaminated eye drops linked to bacteria have led to a 4th death, says the CDC. And so far, this has been in 81 patients and 18 states. And it looks like 13 patients in 2 more states have been added into the latest update for this. All right. This is not good news. Again, we're probably just going to read a headline here. Long COVID seems to make distinct changes to the immune system. Yeah. A lot of people keep questioning, why am I so sick all the time? Why do I keep getting sick? I just recovered from COVID. Now I have this. I just had a cold and now I'm sick again. It's because long COVID and COVID itself damages the immune system. I like to consider anyone who has a damaged immune system post-COVID long COVID. Why? Because you're constantly getting sick, and it's a problem that you picked up from the coronavirus itself, so therefore you're having continuing complications. That to me classifies as long COVID. Moving on to this. Measles alert in Kings County, Washington State. They are reporting a confirmed case of measles. Vaccination status of the individual is unknown, and the source of the infection is unknown. The individual has not traveled internationally. So that means if the person caught measles, there's likely another case out there somewhere. They had to catch it from something, and not good. It just shows that vaccinations were missed during the start of the pandemic, and again, immunity. It is so easy for anyone to pick up a virus anymore. All right, moving on to this. Cow at a South Carolina beef processing plant tests positive for mad cow disease. I have not heard about mad cow disease in some time. I don't even know that I have tweeted about a mad cow disease case since I started this channel or Twitter. It's been a while, so here we go. Mad cow disease is starting to pop up again. Listen to this. If bird flu starts to spread among people, existing vaccines may be inadequate, experts say. Yeah, whatever vaccine we do have for bird flu, it's not going to be enough to stop this, and it's definitely a concern. I have said before, I am concerned that eventually this could come to humans. Is that going to happen in the short term? I don't know if it's going to go human to human. Right now, we are seeing a big animal-to-animal problem, and that problem continues to grow around the world. Look at the sea lion issue in Chile and even Peru. If we see something happen like that in humans, it would be super concerning because the death rate is far higher than coronavirus. It's in the double digits with H5N1 because we don't have a lot of treatment for this. And we don't really have an effective vaccine for it. So it's something we're definitely going to have to keep our eyes on. Alright, moving on to this. We started showing this last week. It's a weekly series we're going to do. We'll be doing it again this week, but I just thought we would show the national picture today. And this is Hubbub World and their data. They have a model which forecasts coronavirus. So for the upcoming week, if you live in the following areas, be advised. New York City, anywhere from Washington, D.C. on up into the Boston area. Illinois, Chicago area, Detroit metro area, Atlanta, Miami, California. Be on the lookout. Be safe. Mask up. There's going to be an increased prevalence in coronavirus in your area according to their model. Anywhere that you see in purple, there's a couple areas. New York City is one of them. Anywhere you see in purple, there could be up to 20 infected people within a 5-mile walk of your neighborhood. Look at California here, around the Bay Area. It's getting to be about 10 to 15 people on a 5-minute walk. And looks like we have some purple popping up in Metro Chicago area as well. So pay close attention if you live in these areas. Walgreens is going to hopefully update tomorrow. We'll have the Walgreens update video tomorrow afternoon before our Monday edition of the Pandemic Update. 25.4% positivity is the current rate around the country, and we were seeing a lot of places rise last week, so that is concerning. We do have one thing in pandemic history today. May 21st of 2020, AstraZeneca receives more than $1 billion from the U.S. government in funding for the development of the AstraZeneca Oxford University COVID-19 vaccine. The first dose is due to arrive in September of 2020. But as you all know, as far as I can recall, AstraZeneca was never approved here in the United States. It was a much bigger deal in the UK. And so we gave them $1 billion from the U.S. government, and yet we never ended up using it. It was a tool we could have had in our toolbox. Taking a look at the BioBot Analytics wastewater, all but one region is dropping. That one region that is dropping is in the Midwest. The rest are steady, not rising or dropping. We did a wastewater video this morning. It's the video just before this. Check that, and you will see the latest wastewater levels. This is now over a week old, but the XBB.1.5 variant is in the lead. XBB.1.16 is at 14.3%, and XBB.2.3 is at 3.5%. New Jersey, we did get somewhat of an update. Hospitalizations are 135. Ventilations, there's 8 people on a ventilator. And when we come down to the ICU numbers, 19 people in the ICU. Cases and trends. I did not see an update in cases. And these lab-confirmed deaths to 2, that's likely old from yesterday. However, hospital-reported deaths are at 6. So that is an increase of 6 because that 6 was not there yesterday. Taking a look here in Pennsylvania, in Philadelphia, my city. We did get an update on the number of EMS calls in Philadelphia County for Saturday, and it was really low, the lowest we've seen in some time, 651 incidents. But I'll tell you this much. Take a look at this right here. This is Montgomery County, Pennsylvania, and let's refresh this to make sure it's accurate. It was just at 18, now it's at 16, but the point is the suburbs are relatively busy today. Let's take a look at Chester County. Yikes. Look at Chester County, Pennsylvania. Heart problems, sick person, diabetic emergency, cardiac arrest. That's not good. So yes, the suburban areas, they are busy today, and personally, I can tell you this much. I've heard a lot more ambulances today than I did yesterday. So I think when the EMS call number for Philadelphia County comes in tomorrow, I think it's going to be higher than what we saw for the Saturday levels. New York State will update again on Monday. They had 477 positive cases on the last update, and the positivity rate in New York State is currently at 2.5%, which is higher than the 7-day average of 2.1%. Something we're going to be paying close attention to this week is, will the New York State positivity continue to rise? It started to rise last week, and remember, these are first-time infections. This data does not include reinfections, but the positivity rate does reflect missed cases. So the positivity rate, it's still a good indicator, with the best indicator being wastewater. Hospitalizations in New York State, the most recent update had 547 and 63 people in the ICU. Texas will update this week, not even worth showing. A lot of these numbers on here for the international data are not quite up to date. Not a lot of places update on the weekends. Let's change this to latest cases, and as you can see here, look at this. All these blank ones did not update. Vietnam added 979 cases, 1 death. Mexico added 1,300 cases, 5 deaths. Iran added 86 cases, 6 deaths. Indonesia added 475 cases and 3 deaths. Let's take a look at some flu data, shall we? We did not go over this week's flu data, and we do have a couple areas of concern, actually 4. New York City's at high levels of flu. Washington, D.C.'s at high levels of flu. Puerto Rico is at high levels of flu. And look at this. California is just borderline, almost hitting moderate. So that's interesting. And you can see it's starting to rise again in Virginia. And it's also starting to rise again in New Mexico. So that's something we will have to pay close attention to. Alrighty, folks. That does it for today's pandemic update. I would like to make one note real quickly. I did talk about this story earlier with the heart. I was not trying to downplay the fact that COVID can do damage to the heart. I was just bringing awareness that there is a big heart issue here in the United States prior to the pandemic, with all these people eating junk food, fast food. I mean, that's always been a problem. We then added on coronavirus worldwide, and well, that showed the true colors of how strained the healthcare system is. And it really sheds light that we need to start paying closer attention to our health, and we need to do more to take care of health issues in this world, because guess what? If we don't, the life expectancy is going to continue to drop. We've watched how much it's dropped since coronavirus has started, and that's not going to stop, because there are so many different reasons combined with coronavirus that deaths and life expectancy is just dropping. And it's something that needs to be managed in this world, in the United States, in the UK, everywhere. Alrighty, folks, thanks for watching this pandemic update. If you like it, give it a thumbs up. If you want to see more content, like tomorrow's Walgreens update or the Monday edition of the pandemic update, subscribe to my channel down below and hit the notification bell, and you'll be notified the next time I do a video. Until I see you all again next time, stay safe, everyone, and have a great Sunday afternoon. Thanks for watching.